how do you know what kind of treatment at what stage in my control of asthma is required? So the modern care of asthma does make it more a personalized care for asthma patients. So in order to do that, we like to deliver you an Asthma Action Plan. And what it means is a piece of paper where we have your details, which is your name, we have your date of birth, and perhaps your phone number and home address, so your demographics. Plus, we want to write up what kind of inhaler treatments you are on currently, or what type of treatment do you use. We also do some peak flow meter checking in the clinics, and we do exhale nitric oxide checking, the FeNO check. And all these things are important to document down on this one piece of paper called the Asthma Action Plan. Because why this is important is when things do deteriorate, we can always measure deterioration, or we can pick up early if things are changing.